Excellencies, Honorable Ministers, dear colleagues, in the WHO African region, the COVID-19 pandemic has reached every member state, and over half the countries have community transmission going on. Although case numbers are seemingly low, African countries and people are equally important to WHO for support. Much has been said about the weakness of African health systems, and many African communities are very vulnerable because of socioeconomic determinants. With food insecurity and exacerbated economic distress, governments are having to balance lives and livelihoods in this response. We are concerned that over 1,600 health workers have been infected and that cases are increasing in humanitarian settings. Governments are working day and night, and WHO and partners like the Africa CDC are supporting them to save lives. Global solidarity is urgently needed to address shortages of test kits across the region and ensure equitable access. We have repurposed more than 900 regional and country office staff and deployed 100 international experts, and we are working with governments and partners to establish humanitarian corridors to provide additional support and supplies. Our assistance in developing national response plans has helped to mobilize over $300 million for public health actions, and we are coordinating with other UN agencies and partners to mitigate the socioeconomic impacts of COVID-19. We are seeing results. Namibia and the Seychelles have not reported any new cases for over a month. Côte d'Ivoire has reduced the spread of cases to the periphery by building on existing primary healthcare interventions. South Africa and Mauritania have mobilized thousands of community health workers. In the Democratic Republic of the Congo, health educators are sharing information on Ebola and COVID-19. Zambia and Zimbabwe are using real-time polio surveillance to track the spread of cases. As we fight this pandemic, we cannot lose sight of other priorities. The African region is on the verge of certifying the eradication of wild polio virus. This is a major public health milestone in Africa, and lessons and tools from this experience are helping direct the COVID-19 response in countries. Modeling studies by WHO and partners show that deaths from HIV/AIDS and malaria could dramatically increase if essential services are disrupted. Countries are reporting stockouts of vaccines, and immunization campaigns have been postponed. These complex challenges call for regional and global solidarity, innovation, and equitable approaches to protect the most vulnerable among us. We count on this to succeed in making health a reality for all people in Africa.